Hi dear students. Most nursing students fail not because they are dumb, but because they have no plan. If you have 60 days, in this video, I will show you exactly how to build a powerful timetable, how to break down topics like diabetes mellitus and stay consistent until the exam day. So this is your turning point. Don't watch this later, watch it now. So to start our video, we're going to look at a question in medicine on diabetes. It says define diabetes mellitus, outline 5 differences between hyperglycemia and hypoglycemia. Okay, then there's state 5 signs and symptoms of diabetes mellitus, and the next question is describing the management and concluding it with complications of diabetes. So how you can use the NMCZ ready to break this question down and make it much simpler is simply what I'm going to show you. Follow me and pay close attention. So on the NMCZ ready platform, if you do not already have an account there, then you just have to visit our official website and you'll be given access. So let's start. Within the NMCZ ready platform, just search for DM, Diabetes Mellitus, and open it in study mode. Once that has been established, you wait for the platform to load. And as it does that, you can start answering the question that we had looked at, which is a question on diabetes. So when your platform loads successfully, it simply gives you the most accurate answers you would need to look at this question. So the first question that this teacher, who is a non-diabetic patient who's brought to our ward in a state of unconsciousness, is to define diabetes. So when the platform is successfully loaded, you have your notes section right there. So you open your definition. By definition, diabetes mellitus is defined as a group of metabolic diseases which are characterized by hyperglycemia, which is simply high levels of sugar due to defects in insulin secretion, action, or both. This leads to a disturbance in the metabolism of carbohydrates, fats, and proteins. We get back to the question. The next part of the question was outline the differences between hypoglycemia and hyperglycemia. So in hyperglycemia, we have got high levels of sugar, or basically, this question is basically asking us to state the differences between DKA and hypoglycemic coma. Within the platform, when you scroll at the very bottom, you see what says DKA, this is hypoglycemic coma. So you open it like that. The first one is the cause as the first difference. In diabetes ketoacidosis, we have got too little insulin. So meaning there'll be high blood glucose and ketone formation, which is common in type 1 diabetes. And in hypoglycemic coma, there's too much insulin or skipped meals. This will result in dangerous low blood sugar, as well as this is very common in type 1 and type 2 diabetes. The second difference is the blood glucose levels. In DKA, which is high levels of sugar, hyperglycemia, we have got the levels of sugar in blood are above 14 millimoles per liter, while in hypoglycemic coma, there's low blood glucose because there's high insulin with usually less than 3.0 millimoles per liter. The breath odor as the third difference. In hyperglycemia, there's fruity acetone smell, while in hypoglycemia, we have got normal breath, no fruity smell. The breathing pattern. Our fourth difference talks about how in hyperglycemia we have got Kussmaul breathing, which is simply deep, rapid breathing. This is simply to blow off acid. That's why the patient does breathe deeply and rapidly. While in hypoglycemia, there's normal or shallow breathing because there's no acidosis. And lastly, we have got the skin and appearance. As a difference, in hyperglycemia, there is dry skin, dehydration, and sunken eyes. While in hypoglycemia, there's sweaty pulse, clammy skin. So shaking or trembling may also be visible before the coma. Then we have other differences like the mental state, the ketones, the acid-base status, and the treatment differences. We also have a simple mnemonic to help you remember. In DKA, follow the terms high, which is simply high sugar, high ketones, high acid, and high dehydration. While in low sugar, which is hypoglycemia, you look at the term low, which is low sugar, low consciousness, low sweating threshold, and low energy. So we get back to our question. The other was state the 5 signs and symptoms of diabetes mellitus. So within the platform, this is provided for signs and symptoms. We have got polyuria, polydipsia, polyphagia, weight loss, recurrent infections, slow wound healing, and blurred vision. So you can see the connection between the symptom and the condition. Polyuria is due to excess urination due to osmotic diuresis. Polydipsia, there's excessive thirst, which is due to dehydration. Each symptom has been explained in full. The other part of the question that we're supposed to look at is the management, medical management, as well as the specific nursing management. So when we get back to the platform, the management that is provided for under the study mode is not the full management, it's an overview. But for the full management, you look at it in the exam ready mode. So just search for DM, medicine, exam ready, and then when the condition opens, we shall be able to answer this question. So the question required us to describe the management we would give to the patient until discharge, starting with medical management. Our medical management within the platform is found in the exam ready mode. So you just scroll to management hub, and here we have got the medical management. When you open this, what we have here and what we're able to see is that you're being told that primary assessment and resuscitation is necessary only for emergencies like DKA. Okay, so the stem of the question required us to manage the patient because this patient is in an unconscious state. I am going to highlight this so that you're able to follow through. The patient is in an unconscious state, so we're going to highlight that in yellow so that we do not forget it. Then we get back to the management. So this is where this applies, the resuscitation, because the question says the patient is unconscious. So we're going to resuscitate following the A, B, C, D, D, and D. Airway, we ensure that the airway is patent because unconscious patients may aspirate secretions. We ensure that the breathing is controlled, provide oxygen because acidosis can impair respiration. Then circulation, we establish an IV line, we monitor the blood pressure and correct the dehydration and shock. Then disability or deformities. Under disability or degree of consciousness, we assess using a Glasgow Coma Scale because altered sensorium is common in severe hyperglycemia. The patient is unconscious, so this applies. And the deformities, you examine for dehydration, Kussmaul breathing, as well as ketone smell to confirm DKA. And lastly, drugs. We ensure that we prepare to give insulin, infusion, and IV fluids to reverse hyperglycemia and dehydration. In that case, we move on to the secondary assessment and diagnosis. So in our question, we're required to outline the whole medical management. So when you look at it, the full management is provided. So in the next video that we're going to do, which is part 2 of this video, we're going to look at the treatment according to the Zambian National Formulary, all the way up to the specific nursing management. For now, thank you for staying throughout this video. You can simply access all these resources on the NMCZ Ready platform. How you can access it, just open your browser, type nmczready.com, this very one here, nmczready.com, you'll be required to register an account free of charge. The first 3 days you can see all the features that are there, and then you can choose a plan if you'd like to go beyond those 3 days. So see you in the next video. Don't stop studying, stop guessing, and start passing.